All right, hello and welcome. Thank you so much for being here tonight to Med School. That stands for My Education and Diagnosis, and we offer this educational series so that our patients can learn some specific things about injuries and ailments that they may be having. My name is Alexis Hunter. I am the Community Liaison for Wilmington Health, and I'm joined by a few of my colleagues, including Dr. Claude Jarrett. Dr. Jarrett is an orthopedic and sports medicine physician who specializes in surgical and non-surgical management of problems of upper extremities, so shoulders, arms. He's going to explain more about that. But Dr. Jarrett has extensive orthopedic experience through many different clinics, hospitals, and such. He's a fellow of the American Academy of Orthopedic Surgeons and currently serves on the board of directors for the North Carolina Medical Society. So before we get going, I want to ask a couple of questions. So just raise your hand. You don't have to do anything else, but how many of you have ever left a doctor's appointment after receiving a new diagnosis and you researched that diagnosis on the internet immediately? Now, raise your hand if you bring that information with you the next time you see that doctor. Now, raise your hand if you think that information that you found online is accurate. Maybe, maybe not. Well, that's why we're here tonight. We are going to listen to Dr. Jarrett and his wonderful words. And so on behalf of everyone at Wilmington Health, we thank you for being here. But Dr. Jarrett, I'm going to hand it over to you.
All right, good afternoon, everybody. Thank you, Alexis. It is a pleasure being here this afternoon with everybody, being invited to give our current topic of discussion today. And as a reminder, as Alexis mentioned, these lectures, they're really geared to be patient-centered and patient-focused. What we really want to do is supplement the information that you've been receiving from your physician and really help to encourage your understanding of what your medical ailment might be. This is a very relaxed environment, so feel free to chime in with questions or insight that you may have as well. And we'll have a good discussion today. So our goal today is to really cover rotator cuff injuries. And this is actually one of the most common shoulder problems that we see in orthopedics. So you will definitely have neighbors and friends and family members, all of whom may have experiences with similar symptoms such as these. These are my disclosures for today, none of which are really pertinent except the very last one. I am not an artist, and you'll see me emphasize that a little bit further on in our talk today. All right, what are we going to cover briefly this evening? Well, we're going to have a good introductory discussion on what is the rotator cuff and what exactly does it do? And then we'll also really talk about how it's injured and what are the current treatment approaches that we offer patients nowadays. And then we'll wrap things up a little bit with the potential future, what's on the horizon with rotator cuff injuries. And you'll see in the top corner of the slide a picture of, that's actually Grandfather Mountain. For those who are unaware, it's one of the beautiful mountain ranges in the western part of North Carolina. And this topic on rotator cuff injuries may seem like a monumentous mountain that we have to climb today, but we'll get there one step at a time. All right, so what exactly is the rotator cuff? The rotator cuff, there are actually 4 muscles that all form one tendon unit. And at the top of this slide, this is actually an MRI of the shoulder. For a reference point, this is the ball of the shoulder, the humeral head, and this is the cup. And this is one of the rotator cuff muscles. As you can see, this muscle here forms this tendon that actually attaches to the ball of the shoulder. So the rotator cuff are actually muscles, 4 muscles, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. But all four of these muscles actually form essentially one tendon unit. And this tendon attaches to the ball of the shoulder. And we call it a cuff because when you see this tendon unit, it actually resembles the cuff on a long sleeve shirt. So that's hence the origin of the term rotator cuff. These tendons actually look like a cuff on a long sleeve shirt. What does it actually do? What's the function of the rotator cuff? Well, there are three main functions. One of the main functions is stability. So when you look at a shoulder from the side, it actually looks like this. This is a axial or a sideways view of the shoulder on an MRI. And you can see this is the ball of the shoulder, and on a cup, this is the cup. And we actually say it resembles a golf ball on a golf tee. Big ball on a small socket. And this mismatch in most circumstances works out to be our advantage. That's why we can swing a tennis racket, we can swing a golf club, we can do the freestyle in the pool because of this mismatch, this large ball and a small cup. But because of this mismatch, we actually need our rotator cuff to provide stability. Our rotator cuff muscles really help keep the ball on the socket, keeps it nice and centered. One of the second functions of the rotator cuff is rotation. And we'll kind of see a schematic of that shortly, but the rotator cuff helps to rotate our shoulder and also is an important aspect of providing strength or power to our shoulder as well. So the three main functions of our rotator cuff are stability, rotation, and strength. All right, now, as I mentioned before early in the talk, I'm not an artist, but I'm a very, very visual person. So what I want to do, we'll do a small schematic on what that rotation function of our rotator cuff muscle actually does. All right, let's see here. So what we'll do, we'll kind of simplify the shoulder and the rotator cuff. So the shoulder essentially is made of a ball, our humeral head, and that ball is attached to our humeral shaft or our arm bone. And we also have that socket that we talked about. So this is the ball of our shoulder, and that's the cup. We also have a roof to our shoulder as well, and that's where our clavicle meets our acromion. And you can actually palpate that roof of your shoulder. If you palpate the top of your shoulder, you'll feel that bony prominence, and that's the roof of our shoulder. Now, the rotator cuff actually travels around the ball and cup and attaches to the ball of our shoulder, just like that beginning MRI of the shoulder that we were looking at. And I'm going to mark the rotator cuff, RC for short. So this is our rotator cuff muscle. So whenever you want to rotate your shoulder, your brain essentially contracts the rotator cuff muscle. And actually, like a pulley, it makes it much easier for your shoulder to rotate up. But whenever our rotator cuff is injured, what can happen actually is that they can tear and we'll actually lose the continuity of that tendon. It will no longer be completely attached to the ball. In this circumstance, your brain is still working really hard. It's still contracting, trying to pull those rotator cuff muscles. But because it has lost its continuity, there's a gap. It actually makes it much harder for your shoulder to rotate. You can still rotate your shoulder because we have many other muscles to pick up the slack, but it becomes much harder. Now, how is our rotator cuff commonly injured? Well, there's two main types of injuries to the rotator cuff. There's an acute trauma. So whether you have a bad fall, a collision, or you have a traumatic blow to the shoulder, that's one of the common causes of rotator cuff injuries. But what is actually the most common cause of rotator cuff injuries is the gradual wear and tear, just the repetitive use over time, just like your favorite pair of blue jeans. You know, we wear our blue jeans, we wash them, we wear them again, we wash them, and over again. And over time, one day you'll look down and those fibers are starting to fray. That same repetitive use and abuse process can also occur to our rotator cuff tendons. And this is actually the most common way that we injure our rotator cuff. Now, how do we commonly treat our rotator cuff? Well, really how we treat it is based on that cause. As we previously discussed, the most common avenue that we injure our rotator cuff is that gradual wear and tear. And physical therapy and rehab can be extremely, extremely effective because we realize that there are many other muscles around our shoulder. And the goal of physical therapy is really to maximize the function of all those other important muscles. And by doing so, they can actually function beautifully, and many patients can recover from their rotator cuff injuries. To supplement with physical therapy, sometimes we do have to take advantage of an anti-inflammatory to address that inflammatory component to our rotator cuff injuries. So your physician may also encourage you to take an anti-inflammatory. But physical therapy and rehab can be extremely successful with a high efficacy for the vast majority of patients with this gradual wear and tear rotator cuff injury. But although physical therapy can be very effective, there are circumstances, whether it's from an acute trauma or persistent deficits despite rehab, that we do have to sometimes consider surgery. And what does that essentially mean? So we go back to our schematic. And we talked about that discontinuity of the tendon. So essentially the goal from surgery is to really suture that tendon exactly back to the bone. We actually are glorified seamstresses. We use sutures to essentially restore the continuity of our rotator cuff tendons. So when it heals, the shoulder is able to seamlessly function as a pulley and rotate our shoulder back to normal with power and with strength. What does a rotator cuff tear look like? Well, if you compare that initial MRI that we saw at the beginning of this presentation to this one, this again is looking at the shoulder from the front. This is the ball of the shoulder and the cup. And this structure is the rotator cuff muscle. But as you can tell, the tendon is no longer in continuity. There is a gap between the end of the tendon and the ball of the shoulder. And when we look at this during surgery, this is what a tear looks like. This gap is where the rotator cuff tendon has torn and is no longer attached to the bone, to the ball of the shoulder. And doing surgery, what we actually do is that we actually are able to assess that tear. So this is an actual arthroscopic surgery as we assess the rotator cuff tear. I'm using these forceps arthroscopically to really see if I can stretch that rotator cuff back down to the bone. And you can see here, by good assessment, we can mobilize and stress that tendon back down to the bone. That's the first step that we do. Next, what we want to do once we identify the mobility of the tendon is that we want to place our anchors into the ball, into the bone. One of the avenues of doing this is that we use these small suture anchors, which are essentially small screws. And we place that where the tendon should attach. So here we are arthroscopically really placing one example of an anchor into the attachment site, into the ball of the shoulder or the humeral head. And you can see once we place this suture anchor or this screw, you'll start to see that there are suture material that is attached to this anchor. And that's what we're going to use to really reattach the tendon. Once we've placed our anchor, then we have to really pass the sutures through the tendon edge. So here we are arthroscopically. We are weaving our suture material through that tendon. And this is going to allow us to really reattach and suture that tendon back to where it should be, restore that continuity. And we systematically are able to do this arthroscopically. We pass and we retrieve. And now we're step by step weaving our suture material through the end of that rotator cuff tear. Once we've passed the tendon through, once we pass the suture material through the tendon, then we actually start to suture everything back together. And here you can see we are arthroscopically tying our sutures. And by doing so, we are restoring the continuity, bringing that tendon back to its normal attachment site, back attached to the ball of that shoulder. And this is essentially what we call a standard classic rotator cuff arthroscopic repair. So in a very simplified approach, this is what we do surgically. We identify the tear, we place our anchors for where we want to reattach our tendon. We weave our suture materials through the tendon, and at the conclusion, we reattach and close that discontinuity. The tendon now is back attached to the bone where it should be.
Dr. Jarrett, could you explain a little bit more about what arthroscopic means? Like kind of the breakdown of that? Like I know it's a scope, but.
Yes, great question. So arthroscopic surgery essentially means that we are fortunate enough to use tiny cameras and tools and no longer have to use big incisions anymore in order to do shoulder surgery. So essentially we use small cameras with small tools through small poke holes. So no need to place a large incision any longer. And by placing smaller incisions arthroscopically, this helps patients recover in a much more timely manner nowadays. So this is a very fantastic advancement in orthopedics over the past few decades.
Awesome. I have another question too from Kathy here. What is the suture material?
Yeah, the suture material is actually very strong synthetic material. And it is as strong as wire, but it's actually fabric. So it's this very synthetic fabric that is extremely strong and very effective for this scenario. Great question. Feel free to continue with the questions. We'll continue on through this discussion today. So how does this repair look afterwards? So again, this is the before, where we looked before. This is the tendon, the muscle, the rotator cuff muscle, and it's no longer continuous. There's a gap. And this is after we do the repair. Now the tendon is back continuous, and these are one of the anchors that we use to reattach that tendon back to the bone. And this is following an arthroscopic repair, restoring that continuity of that rotator cuff muscle and tendon. And afterwards, that really allows that shoulder to restore its rotation capacity, power and strength and stability. And this is that earlier patient that we saw at the very beginning. Now, what does the future hold? Well, I think the future is going to be very exciting. One of the main avenues that we're working on is really taking advantage of biologic injections. Our body naturally has healing cells, just similar to whenever you have an infection, your body has the capabilities often to really treat that infection. But what we have to do is take advantage to really stimulate our body's immune system. In a similar fashion, we think we'll be able to, at some point in the future, really stimulate our body's natural healing capacity by turning on the resting healing cells. And in the future, hopefully, we'll be able to repair these tears by a simple biologic injection. And this is something that we've been researching very closely over the past decade. This is one of the studies that we performed a few years ago and published, where we found this is potentially true. We were actually able to deliver growth factors through an injection, and that really increased the amount of pro-healing cells for rotator cuff injuries. Now, this was in the lab, so this is very basic science, but we're excited to see this come to fruition, and we think in the future this is going to be a good avenue for a lot of patients. So the future is going to be bright. We think at some point in the future, we'll be able to actually heal these tears just with delivering injections and stimulate our own body's innate ability to heal. So the future is bright. So, so in summary, the rotator cuff injuries are very common. These are concepts that we can all appreciate and enjoy. And I hope this provided a little bit more insight to you this afternoon. Thank you for allowing me to participate today.
Dr. Jarrett, what is the recovery time commonly from this type of surgery?
Very good question. So we are somewhat at the mercy of Mother Nature in healing. Although we can often reattach that tendon when we need to perform surgery, but we do have to allow healing, and that takes on average 6 months to really obtain good healing following a repair. So the recovery is not quick. It does take time, but fortunately, we can opt to get these to heal well for most patients.
Does part of the recovery include certain things that the patient has to do, or exercises, or things like
It does. It does. There are different phases in the recovery. There's an initial immobilization phase where we have our patients wear a protective sling for a few weeks. And the length of sling immobilization really depends on the type of tear, the size of tear, and those variables. But after a few weeks of sling immobilization, then we do start a physical therapy program that's really geared towards regaining motion, strength, and dexterity of the shoulder. But that is a gradual process that we implement over several months.
so they can get back to like fast pitch baseball?
Get back to playing tennis,
Right.
playing pickleball, which is very popular, swimming, all these activities. That's the goal. Fortunately, we're able to do that for most patients.
So you were stressing the importance of physical therapy after surgery. And is there any risk of not following, like, non-compliant patients, if they aren't following those guidelines? What can they have a risk of? Maybe not having that mobilization? What harm could that cause?
Yeah, it's very important to really adhere to physical therapy recommendations of your physician, because physical therapy is very important in restoring motion, as well as restoring strength as well. And unfortunately, if one is unable to really follow the recommendations, you are at risk for becoming very stiff and losing motion, which can be a very tough problem to overcome. So it's always really good to do both parts, make sure that you're abiding to the recommendation and following both your physician as well as your physical therapist as well.
I've got another question here too. After an injury like this, do you ever notice any type of deformity or change in the shoulder's appearance from the outside?
Typically not too much, but again, there is a spectrum. So some patients may have a more severe type of injury, but the vast majority of patients should not notice a asymmetry once they've recovered.
I had a question.
Go ahead.
Okay. So Dr. Jarrett was saying that there's just that one tendon that's the rotator cuff. But I know when I was diagnosed, they said I had tears in multiple tendons. What does that mean?
Great question. So conceptually, the rotator cuff is one tendon unit. There are different aspects of that. So there are different sub portions of that one tendon. And also there are other tendons around the shoulder that can be injured as well, such as the biceps tendon as well. So it is definitely possible that when you really delve into the details, there may be different aspects of that tendon unit that was injured, as well as adjacent tendons in the shoulder too.
And so you fix all of that. It's considered rotator cuff repair?
We do kind of address it as in most circumstances as a tendon unit, but there are different aspects of that tendon unit that we do have to really specialize when we get down into the nitty-gritty.
Thank you.
Dr. Jarrett, I know that you mentioned that that so much of this is from wear and tear, but that if someone who is used to, being an athlete or is an avid golfer or tennis player, after rotator cuff surgery, can they expect to get back to their activity or sport at the same level that they at one point could? Or do you typically see that there's a little bit of lag in that? What are your typical thoughts on that?
Yeah, it's a great question. No, fortunately nowadays for most patients, we do have that expectation that with healing and recovery, ultimately, they can get back to doing those activities. That's certainly the goal. Now, the time frame of how that occurs may not be as quick as we all would like for it to be.
Sure.
But fortunately, today with the advances in orthopedics, we can restore essentially good function, near normal function, to the vast majority of our patients.
This is Ron. Just want to make a quick comment. I'm a recovered patient from Dr. Jared's handiwork. And for people that are on thinking about the surgery or anticipating the surgery, I would tell you that my experience with Dr. Jared and having a full repair work, I had a phenomenal outcome. And I would say that my experience at Wilmington Health was absolutely phenomenal, and wanted people that are on to know that, and they took absolutely great care of me.
And definitely, we do want to emphasize that most patients will not need surgery. There are a lot of patients, depending on the type of injury and the circumstances around their injury, that often we can be successful in managing their injuries with good rehab, good physical therapy. But fortunately, whenever that does not work, we do have other alternatives for a lot of patients.
Well, we sure do appreciate everyone joining us this evening. Thank you, Dr. Jarrett, for your wonderful presentation. It was educational. I know I learned a lot, and I hope that everybody else did as well. But from all of us at Wilmington Health, we sure do appreciate you and your interest in learning more about rotator cuff injuries and treatment options. So be sure to visit our website that you see listed right there if you have any more questions, and we'll look forward to seeing you in our offices. Thanks so much. Have a good night.